One of the most common complaints that we see in the office is, I can't breathe through my nose. I'm exercising, I have to breathe through my mouth. I'm trying to sleep at night, I can't breathe through my nose. I wake up with a dry mouth, my tongue is stuck to my palate, and I'm really having trouble with it, and I'm just tired of it. So, nasal obstruction can have many causes, but there are some very common ones. The most common that we see is a nasal septal deviation. So, everybody's heard of a deviated septum. So the septum is the wall that separates the nose and the left and right halves. And it's a sandwich of cartilage and bone that has a mucous membrane covering. Now that can be deviated and cause a decrease in the flow of both or one side of the nose. And it can occur from just the settling of the nasal septum. It can also occur from trauma. People say, gee, I had a nasal fracture when I was playing volleyball when I was a kid, and we never really looked at it. Or you could hit your nose on the coffee table when you're 3 years old and also get a fracture that really goes undiagnosed because it doesn't create any external deformity. So part of the determination of what the nasal obstruction from is the history. So is there a history of trauma? Is there a history of nasal polyps? Is there a history of sinus infection? How's the sense of smell? And usually if all those things are okay, but I just can't breathe through my nose, then it's a nasal septal deviation. Also, when the nasal septum deviates to one side, it creates extra space on the opposite side. And then we have the turbinates. The turbinates are the things that warm and humidify air on the way to the lungs. The turbinate in the side opposite the septal deviation doesn't like all that space because its job is to warm and humidify air on the way to the lungs. So it gets larger over time, not knowing that you can't breathe well on the other side. So people often say, yeah, I was okay with it for a while. I just had my right side plugged, but now both sides are plugged. At night, I have to sleep on this side for a couple of hours, and then I got to roll over and sleep on that side for a couple of hours, and one side is always plugged. And the reason for that is our brain doesn't like to have both sides plugged. So it'll squeeze one side for a while, and then it'll squeeze the other side for a while, and all the time you're tossing and turning trying to catch up with that. So the physical examination is the second part of diagnosis, and it's very easy for us to look in the nose and see that there's a nasal septal deviation. We also want to make sure that the sense of smell is okay and it's not due to polyps, and that you're not having midfacial pain and pressure, pussy nasal discharge, tooth pain that would suggest a sinus infection. So those are things that we want to rule out by history and examination. If those are ruled out and you have a septal deviation and turbinate hypertrophy, which is the enlargement of the turbinates to grow into that space, then conservative therapies first. We generally like to use saline spray, let it sit for a bit, blow your nose, and then you use a nasal steroid spray. Now this is not an oral steroid, it's not going to get absorbed in your bloodstream. It's a topical that can reduce the size of the turbinates enough to get a better nasal airway. Because you're going to say, well, gee, is any medicine going to straighten out that bone and cartilage? And the answer is no. But if we can create room by reducing the turbinates, you might be happy with your nasal airway. So, saline in the morning, let it sit, blow your nose, and then nasal steroid spray right hand, left nostril, left hand, right nostril. That keeps it away from the nasal septum and toward your tear ducts. And then you lay over the bed and let your head hang over the bed for 1 to 2 minutes. That gets it up to where it needs to be. Usually in the 2 to 4 week time frame, you're going to feel like, oh, it's either working or it's not working. So we generally see people 4 to 6 weeks after that therapy. If there is still nasal obstruction and the symptoms warrant it, meaning people say, gee, I really hate the way I breathe through my nose, I can't exercise, can't breathe at night, then they're a candidate for nasal septal reconstruction, which we will cover in another segment, and reduction of the turbinates. And that generally has a greater than 90% success rate in terms of making a nasal airway that people are happy with. The other causes that we talked about, nasal polyps, sinus infection, and more serious causes, we will cover in another segment.